Good afternoon, everybody. As you start joining us, we'll be gathering here. We will start promptly or very shortly after 1 o'clock. We want to make sure everybody is in the right place. The Minnesota Road to Volunteer Driver 2022 forum, because now we have to date them because we've had multiple forums. So welcome aboard. October 6th, a beautiful fall day. Hoping you're enjoying it. And as we continue to gather, you might notice me staring at you blindly because we'll wait till everybody's on board. Thank you. You're going to hear this announcement a couple of times. We are waiting for everybody to get on board. We're a few minutes before 1 o'clock. We'll be starting shortly after 1. Minnesota's Road to Volunteer Driver 2022 Forum and October 6th, beautiful fall day. Thank you for joining us, and we'll be starting shortly. Thank you for joining us early on this Minnesota Fall Day. We are the Minnesota Road to Volunteer Drivers 2022 Forum, and we'll be starting shortly at 1 o'clock or shortly thereafter. We're just making sure everybody gets on to the webinar. Thank you for waiting. Thank you for joining us a little bit early. Appreciate it. It's a beautiful fall day here in Minnesota. Minnesota's Road to Volunteer Driver Forum 2022. We'll be starting at 1 o'clock or shortly thereafter. Again, we're just encouraging everybody to get on board for the webinar. Thank you for waiting. Thank you for joining us today. It is 1 o'clock. The Minnesota Road to Volunteer Driver for 2022 forum is now beginning. I am Tom Gottfried, and I'm here to walk you through some of our logistics of today's meeting. We're still having people still join us, so hopefully we'll get caught up at that point in time. This is sponsored by the Minnesota Council on Transportation Access. And the housekeeping that we've got is to submit questions for a speaker. Use the Q&A feature at the bottom of your screen and just type in your question. If you're joining by phone, and if you have a question for a speaker, press *9 to raise your hand. To turn on live captioning, click the More button at the bottom of your screen and then select that option. ASL interpretation is being provided, as you will see here, as she is being spotlighted. And we'll continue through all that. There will be some transitions, but hopefully those are pretty seamless, and we'll get moving on to that. If you have any tech questions or any problems with audible, hearing, seeing, whatever it happens to be, please use the chat feature to all panelists, and we will be monitoring the chat and try to assist you with any technical issues that we can help you out with. We'll give another minute. There we go. Thank you. Today's agenda is opening and welcoming. I'm Tom Gottfried, as I said, with the Minnesota Department of Transportation, and I'm also the Minnesota Council on Transportation Access Executive Director, and we're the host agency for this forum today. In today's introductions, I'd like to introduce myself, as I did, and Tiffany Collins is the Director of Transit with Central Community Transit System. I call her CCT, sorry about that, and the Wilmer Volunteer Driver Program. And we got Beverly Silentoliver, the Senior Planner for the Regional Transportation Coordinator for the Arrowhead RTCC, or the Regional Transportation Coordinating Council, and the Arrowhead Regional Development Commission. Thank you for those two for joining us today. And our special guests and presentations will be given by Sherry Munyon, who will be talking to us about the guidance on the recent state legislative changes and the proposed federal legislative changes. Some action that's been happening recently, and Sherry's going to get us up to speed and up to date. And of course, we'll take any questions and from there. Our other speaker for today is with the Hopscotch program. Alan Herman is a TCAP or TCAP Mobility Manager and Supervisor. Transportation Coordination Assistance Project is what TCAP stands for, and is also the director for the Smart Link Mobility Management Program there. We are very pleased to have these two speakers with us today. This is part of our forum series, our ongoing forum series on volunteer driver programs, as we continue to support them, provide technical assistance, as at the same time some learning and training opportunities as we move forward. Next slide, please. So again, some housekeeping is to turn on your live captioning, click on the More button at the bottom of your screen, select that option. If you have questions for the speakers, and we anticipate you should and like to have you and participate, use the Q&A feature at the bottom of your screen to submit your questions at any time. These will be read verbally by a moderator during the Q&A time. If you're joining by phone, press *9 to raise your hand. The host will then unmute you during the Q&A time to ask your question. If you have any technical questions, send a chat to all panelists. We'll be monitoring and try to help you accordingly to resolve any technical issues. A video recording of this forum will be posted to the website following the event. Website will be given at the end, and a PDHF form, professional development hours, will be emailed to all attendees during the following the event. Next slide. Why are we here? The Minnesota Council on Transportation Access, MCOTA, with its 13 agency partners, along with the regional transportation coordinating councils, as well as the transportation coordination assistant projects, the metro area, are here and working with the Minnesota Volunteer Driver Coalition, have been focused on the issues and concerns of the health and sustainability of Minnesota volunteer driver programs. In 2018 and 2020 and 2021, and now for 2022 and 2023, the Volunteer Driver Forum Series, as we continue to do them, are here to provide you the latest information, best practices, and updates on where these programs are today, or even potential legislation that's going to be impactful to you. Next slide. How did we get here? MCOTA has 4 active work teams. And MCOTA is the 13 state agencies I mentioned before, and each of those agencies has representation on the council. This includes the Department of Human Services, Department of Health, Department of Education, Board on Aging, the Council on Disability. All 13 different state agencies are attached to this. And we've divided up into 4 work teams, including those members from the MCOTA membership to participate in that. I apologize about my dog barking in the background because he just saw some guests come. The advantages of working from home. Anyway, the accessibility Olmsted work team, the communications work team, the removing barriers work team, and the volunteer driving work team. And this forum is based on and been presented to and brought to you by the volunteer driver work team. These work teams are established in the MCOTA senior leadership, commissioners, and board chairs to program priority workshop that will happen in October of 2021. The topics that we're going to be looking at, specifically in the volunteer driver program, was vetted through that process and then identified as the need to continue, for example, these type of forums and series that we're going to be doing. Next slide. Where are we today? All MCOTA work teams are modeled after the previous volunteer driver and communication work teams. They've been around much longer than any of the other work teams because those issues have been a long-standing problem that we've been trying to address at MCOTA. All 4 MCOTA work teams have the MCOTA approved work plans that address the MCOTA senior leadership and MCOTA's transportation access priorities for this next 2023 through 2024. And I'll let Tiffany and Bev describe that in a little bit more detail. Next slide. So to that end, I'm going to turn this over to, I believe Tiffany's going to kick this thing off.
Good afternoon, everyone. Yes, I am co-chair with the MCOTA volunteer driver work team, and we've been the longest standing work team in MCOTA, and so we're happy to say that we're the most established, and we've been working on some things along the way. And as Tom mentioned, you know, there's a lot of volunteer driver issues that we've been trying to address over the last couple of years, and wanted to provide a brief update on some of the activities that our work team is responsible for and working towards. So first of all, there was some legislation that was passed at the state level, and we have worked on a fact sheet. And so that is one of the top priorities that we had, first of all, is to try to get some of that legislation figured out between the Department of Revenue and the Department of Commerce, and trying to give it some voice as far as what did that legislation mean to us as volunteer driver providers, as volunteers, agencies that work with volunteers. So we did, we were able to put that fact sheet together. That was available out in May of 2022. If anybody is looking for that or a copy of that, that is available on our MCOTA website, and we make sure that everybody has that available to them. Secondly, we are using that fact sheet and the information that has been gained from that to produce a brochure that is more focused on the users, the volunteers, and just trying to promote volunteerism and a use for that, and is putting together a brochure that will be presented at the next MCOTA meeting, and we anticipate that being adopted as well at the November 2022 meeting. So that those 2 documents will hopefully help a lot of people that are working with these programs, that are potential volunteers, who are volunteers, and working through some of the issues that have been hopefully solved or reduced by some of the legislation that has occurred. And we're trying to diligently be able to share that information so that it can be helpful as we move forward. And the next objective was obviously to continue with the forum series, and today, that's why everybody is here, is getting that first volunteer driver forum in this particular series going again. And so we're all very happy to have everybody on today to listen to what our updates are. And so we're excited to hear our speakers today talking about the legislative updates as well as creative alternatives to expand the volunteer driver program and be unique and creative with the volunteerism that we do have in our state. So we all also look forward to the second volunteer driver forum that we are tentatively scheduling for February 16th of 2023. So please mark your calendars and watch for further updates on that as we plan to add different topics to that as well. And then finally, some other things that we would like to, and we are planning to work on is the updating of the 2027 volunteer driver program research. And so that is very important as well, as we are going to be focusing on the previous research and then trying to expand on that, looking at alternatives and solutions for the future. Especially since COVID-19, as we've all experienced changes and different transitions that have occurred during that time. Also updating the cost benefit analysis for the volunteers. So we want to make sure that we have good data that we can share with everyone with that, looking at benefits and barriers to the volunteer driver programs. And then also looking at some potential driver training for volunteers related to their insurance, rider needs, reimbursements, and Medicaid. So those are some of the activities that we have planned in our 2023 work plan. And we look forward to these forums to be able to share those too. And we also are very interested in hearing from you any comments or suggestions that you may have that we can use as we move forward with the work team. I will turn it over to Beverly so she can share information about the RTCCs and TCAPs.
Great. Can we have the next slide? So hi, I'm Beverly Sloat-Tolliver. I coordinate the Arrowhead RTCC, and each RTCC and TCAPs, we all have our own mission statements, but they can be summarized as to improve mobility and reduce transportation barriers. In response to the loss of volunteers due to the pandemic and any other circumstances, the RTCCs and TCAPs have provided support in the forms of new programs, as we'll hear about the Hopscotch program later, grant assistance, community outreach, and participating in state groups such as MCOTA and then the statewide Volunteer Driver Coalition. So I'm going to just touch on a couple highlights. There are several more examples from our other RTCCs and TCAPs. So this is a very small snapshot of some of the things these groups have done to help support volunteer drivers in the state. My own RTCC, we met with the volunteer driver agencies as well as the Arrowhead area on aging to talk about where we could help fill the gaps. And some things that came up were newspaper ads. We funded and printed 18 ads in the region promoting volunteer driving. We also, with that, made a focused web page to access information on how and where to volunteer. We made brochures and then also participated in the Minnesota Public Transit Alliance Washington, D.C. fly-in to advocate for support of volunteers with our legislation. Mid-Minnesota, they were one of the first RTCCs to bring this issue to a public light recently. Terry, their coordinator, contacted a WCCO TV news reporter who was originally from the region on the critical shortage of volunteer drivers. This resulted in an interview with our very own Tiffany Collins and a volunteer driver, and talks about the challenges as well as the pressing need for volunteers. So this was a great kickoff to supporting and shedding light on this issue statewide. Terry's also presented at different community groups to encourage volunteering, including their local 55 Alive classes. So these are classes that help older adults who can help get discounts on their auto insurance by attending. And then older adults who are still within driving are the usual volunteer driver pool. So these presentations encourage the participants to consider volunteering. And he had noted that a lot of success in this was making good conversation and good relationships with course instructors. And so, like I noted, later in this forum, you'll hear about the Hopscotch program. And then if you'd like to learn more about the RTCCs and TCAPs specifically, so our information is on the MCOTA webpage if you want to contact your regions directly. And then myself and a panel of representatives will be presenting at the St. Louis Human Services Conference next week. So next slide. I think this is Tom. Now would be introducing Sherry.
Yes, Sherry had a very extensive background, and Sherry and I have been working for, many years, practically almost all of her 35. It's been all of my 34 relative to public transit and access and services. So Sherry has a huge background and experience with that. She works with the Minnesota Public Transportation Association and has been directly working with them for years. You may wonder why the public MPTA is attached to this. Some of the largest volunteer driver programs are operated by many of the public transit systems, and they certainly cover a very large portion of our state with their volunteer drivers. There is all kinds of volunteer driver programs out here, and the other organization that Sherry is working with in collaboration with is the Minnesota Volunteer Driver Coalition, which was formed about 2.5 years ago, I believe, and has really gained some real traction on some legislation, and let Sherry talk about that in her discussion in that. As we concentrate on, a variety of different things, Sherry brings a wealth of background and experience with her governmental relationships and the capital access programs, and concentrates on nonprofit associations work, which is very interesting and very parallel to most of our public transits operating in rural systems in greater Minnesota are operated by private nonprofit organizations. So that relationship is very tight. And also she is on the board of directors for the Forward Global Women. We very much appreciate Sherry taking the opportunity here, and she has a lot to share. So I'm going to turn it over to Sherry to let her walk us through this, I think, very exciting time. So thank you, Sherry.
Thank you, Tom, and good afternoon, everyone. Welcome. Thank you for joining the MCOTA webinar today. And as Tom said, I'm going to talk about what's happening legislatively at the state level. It'll be a short review of what we accomplished in 2021, and then I'll talk about our current efforts at the federal level. Next slide, please. So obviously, we all share the goal of protecting volunteer driver programs. Our efforts are to make sure that these programs are viable. With nearly 2,000 volunteer drivers across the state, they serve a variety of individuals and allow them to live at their homes where they choose to be, and making sure that they have transportation, access to health care and food security, as well as other important trips. And one of the critical pieces here is to make sure that volunteer drivers are fairly reimbursed for their trips. The disparity is significant between a volunteer driver's charitable mileage reimbursement rate, 14 cents, and about 4.5 times that amount is paid to an individual for their mileage reimbursement for business purposes. We obviously know that this isn't equity and it doesn't cost less for a volunteer driver vehicle than it does for a business vehicle. Next slide, please. I want to give a quick shout out to the Minnesota Council on Nonprofits. Actually, it was the Council on Nonprofits who brought the first piece of legislation forward at the federal level to change the charitable mileage reimbursement rate. And since then, the Minnesota Public Transit Association and the coalition, together with the Council on Nonprofits and many other partners, including government partners at the township, city, and county level, have been working on this collaboratively. With the difficulty in making a change at the federal level, we began focusing on what could we do in Minnesota state law that might make it easier for volunteer drivers. And there were two issues that had come up. One was volunteer drivers were paying taxes on any mileage reimbursement over the federally allowed 14 cents. Then we had automobile insurance companies who interpreted that reimbursement that they were paying taxes on as income. Because of that, their insurance rates were increased, and they were actually considered to be more like more like an Uber or Lyft driver than a volunteer driver. So those were the two issues we tackled at the Capitol. And we did change the definition of a volunteer driver to clarify that that individual who is paid for expenses in their duty as a volunteer driver is not a for-hire carrier. This, we hope, will help with the insurance. However, we know it's not the end-all solution, as some insurers will still look at the number of miles that are driven annually by a volunteer. The second issue that I had mentioned was income tax liability. And we were also successful collectively in making a change at the state legislature that allows a volunteer driver to claim an income tax subtraction on their state taxes for mileage reimbursement. So again, that's not a total fix because that still leaves volunteer drivers with liability at the federal level. And so there's still some tax liability associated with that. Next slide, please. And before I talk in more detail about the disparity, I just want to mention that one of the critical reasons we're seeking this federal change is because it is the right thing to do for volunteers, and also because it's the cost-effective thing to do for our nonprofits, our public systems, and for the state federal dollars and federal dollars that are flowing to the program. So these statistics are a little bit old right now, and particularly with the change in the cost of fuel prices, they're probably a little bit under, but our past statistics, we were using an average of $60 an hour for operating, maintaining, and staffing a public transit vehicle, which can be replaced by the 56 or 62 cents mileage reimbursement rate, and then prevent the wear and tear on our transit vehicles. And the cost for a volunteer driver to provide service, and one of the examples we used, which was critical, was from Wilmer to St. Cloud, taking an individual to the Veterans Hospital up there. The mileage reimbursement rate was about $74 for a round trip, and had, when a carrier was used, a paid for hire carrier, it could be $350 or more. So those are the kind of dollars we're talking about saving by having a small and fair mileage reimbursement rate for our volunteer drivers. So this slide talks about the federal initiative that we're working on right now. And what we're asking is very simple. We're asking to change the federal law to allow the IRS to establish the rate for the volunteer mileage reimbursement exactly the same opportunity they have today for the business rate. And the problem, obviously, is every year the IRS makes the change depending on the economy and fuel costs on what the reimbursement rate will be set for business drivers. However, since it takes an act of Congress to change law for the charitable rate has stayed at 14 cents where it's been since its inception. In April of this year, we had a request to our congressional delegation. We actually reached out to them months before, but Congressman Stauber was the first one who agreed to introduce the bill as we wanted it. And that is simply, as I just explained, to allow the IRS to change the rate. Congressman Stauber was joined by 2 other Minnesota representatives in co-sponsoring the bill, Representative Craig and Representative Phillips. So we thank them for their support. And this bill would permanently increase the rate and allow the IRS to continue to increase it to match the federal rate. Next slide, please. In June of this year, things got worse for volunteer drivers. As we all know, the fuel prices increased dramatically, and the IRS had the authority and did make a change that would assist our business drivers. However, they didn't have the authority and no change was made for volunteer drivers. So we saw the disparity grow. Instead of 14 cents to 58 cents, now we saw 14 cents to 62.5 cents as the difference. And the IRS actually made it clear that they were adjusting the mileage rates because of the fuel prices and the costs that it were applied to businesses. And so it's ironic that, again, it's very clear that there are costs associated with using your own vehicle, and yet the volunteer drivers continue to lag behind. Next slide, please. Because of the fuel price increases, Congressman Craig took a look at this as an opportunity to maybe put pressure on the Ways and Means Committee in the House to actually increase the rate for volunteer drivers, charitable reimbursement for at least 2 years. And we were contacted by Congressman Craig's office and asked if the coalition would be supportive of this effort. And we agreed that we would be supportive of this effort. We all know that when you're working with the legislation in the state or federal level, not everything happens overnight and not everything happens in full. So we will take incremental progress when we can. However, when the bill was introduced, the Congressman Craig's bill did have a provision that we cannot support. And the provision had good intentions. It was to say after the 2 years, the rate should increase from 14 cents to 24 cents. And the rationale for that was, had inflation been applied to the 14 cents, the current rate, just based on inflation, would be 24 cents. And then it further allowed for that to be increased in the future, but on a nominal basis. So this, we feel, is a step backwards. We think the temporary increase is beneficial for current volunteers. However, then adjusting the base rate for the future at 24 cents, we believe will prevent us from achieving the goal of parity and at least delaying it by years. I think if you had about a 1% increase per year on that 24 cents, you can see we'd be decades behind and never catch up. Next slide, please. So it gets a little bit tricky when we have these changes that are difficult to support. We are in conversation with staff at Congressman Craig's office, but also with the senators' staff, for Senator Amy Klobuchar and Senator Tina Smith. Those legislators also introduced the volunteer legislation that models the Angie Craig bill. So we've had dialogue with them, again, asking as they continue to work on the issue over this winter, they also leave out the 24-cent part of that legislation and put all of their efforts and focus just on the 2-year increase. The other piece that we're waiting for at the federal level is that we need to find out what the cost of the program is. And so we're hoping to see that in the next couple of months before the end of the year. And this provision, if it is successful, if the legislators working on our behalf are able to achieve the 2-year increase, won't likely happen with any kind of a committee hearing. It'll likely be done by an amendment to the bill. Next slide, please. I've kind of already addressed the concern, so just quickly, and partly I say this, so as you're talking with congressional representatives over the next few months, always we're letting them know how appreciate the Volunteer Driver Coalition and our membership is of all of their efforts. We know that these efforts are crucial to volunteers. And we also remind them that the temporary increase, as helpful as it is for our existing volunteers, isn't an incentive to recruit additional volunteers. And that's a major issue that most of you are facing, how to reach out and bring in additional volunteers. And then the other part of the bill is that we think it's just failed policy. The major concern we think can be addressed for the short term, and then we'll continue to work in the future on a long-term effort. Next slide, please. The federal and state action needed, we're really just focusing on federal at this time. And if you are not already a member of the Volunteer Driver Coalition, we strongly encourage you to do so for 2 reasons. We'd love to add you to the list of supporters. You know, we are approaching, I believe, 90 members in Minnesota who support this change. And it's very helpful for our members in Congress to see the breadth of support that we have. And everybody always looks to their community to see if there are organizations in their community who are supportive. So this is helpful. In addition to that, there will be updates provided through the coalition. There are meetings that are scheduled through a coalition that all members are invited to attend, where we will provide updates on our ongoing efforts at the federal level. And we're likely to be sending out a call to action in the near future to reach out to congressional members. We do have a link that can be used to access our US senators' offices and our US representatives' offices. And we can also send that out separately to you as needed. Again, the coalition has been critical. It's terrific that we have state coalition members who have national associations. So the Minnesota Public Transit Association also has the National Transit Association as a partner. They are supporting our efforts. And so they are reaching out to a broader group of congressional and US Senate members in support of these efforts. Similarly, for the Minnesota Township Association, they have brought this issue forward to their national association. Their representatives are also talking nationally to members in support of the efforts. And I already mentioned the Minnesota Council on Nonprofits, and they're active as well. So this interest and support at the state level compounds at the federal level, helping us because we know this will be an ongoing effort. And I'm going to share a link to the hosts of the meeting, and I think they'll be able to share it with everyone else. This is a link to the Shared Use Mobility Center in California. And one of my co-chairs at the Volunteer Driver Coalition, Beverly, who is on with us today, had reached out to them to share what was going on in Minnesota. And after some conversations and dialogue, this resulted in them having a great interest in our state and national efforts. And they have put together an article and posted it on their webpage for it to be seen by other national advocates. So with that, I'll take a breath and stop. I'd be happy to answer any questions that you might have. And I apologize, I think I forgot to do that after this.
No, sure. No problem, Sherry. We do have one question here, and it's a little long, but there's some good background information to help clarify the context. So is MCOTA or other groups addressing the AARP concerns with physical driving roads with visible signage lines, very clear street lines, larger lighting, necessary sidewalks? Volunteers are usually seniors and they need safe driving roads, etc. Oh, this is good. I've worked with specialized transportation for about 20 years. It's a very slow process until seniors become part of our large population. So, yeah, are we looking at any of those infrastructure pieces that will help make driving safer for those that are volunteers and otherwise?
Thank you for the question. I can't speak for MCOTA, but I will speak for the coalition and say that no, we are not working on that issue. We are working with sole focus on changing the mileage reimbursement rate and not any of the other policies that would help make it safer for drivers at this time.
So do you mind if I add to that, Sherry?
Pardon me?
Do you mind if I add to that?
No, please.
Sure. Yeah, I will say though, as a coordinator of the region of RTCC, that that could be a avenue to start working and talking to the infrastructure layer of transportation, where is our mission to get those all those transportation stakeholders together at the table and have a means to communicate those type of needs. So I would say if that is something of concern and where you could see some change makers in your area, to contact your RTCC coordinators or the Department of Transportation directly.
Thank you, Beverly.
I don't see any other questions at this time. Tom, you popped up.
Yep, Tom's stepping up because I do represent MCOTA. This is a topic that the added topic of the sight lines and visibility and making the roads safer obviously is a very much a MnDOT agenda item for us to be looking at. As I mentioned earlier, and you met two of the co-chairs of the Minnesota Council on Transportation Access Volunteer Driver Work Team, that could be a work item for them to be considered for that. But I'll lean into the two co-chairs if this is a topic we can pick up. So please get a hold of us and we'll continue that conversation. Look forward to it.
So I don't see any other questions in the chat, but Sherry, could you maybe expand on that? It's I'm trying to say the tax ramifications of the charitable rate versus the business rate, and part of that being the motivation for this legislation.
I'm sorry, I'm not sure I understood the question. Talk about the variance.
Sure. How that there's the charitable rate is taxed at a certain level versus the business rate.
Sure. So because the federal government established a maximum rate of 14 cents as the charitable mileage reimbursement rate. If a volunteer driver receives 14 cents only, there's no tax implication. However, if the volunteer driver receives more than 14 cents, and vast majority do, I think the average is somewhere around 40, 45 cents. I'm not sure this year. But if they receive anything over 14 cents, then it's income. That's considered income. And they have to pay taxes on it. And for the organization who works with the volunteer driver, when they pay income of $600 or more a year, and again, this is the reimbursement over the 14 cents per mile, then they're required to file a statement with the IRS that they have paid an individual, they name the individual, that amount of money.
Thank you. There's a follow-up question here. Do you know if it is the case that members of the RSVP Senior Corps are not responsible for federal tax implications?
I can't answer that for certainty. Maybe Tom or somebody else from MCOTA has, but I am aware that there are some exceptions in federal law. And I believe they're mostly related to DHS.
Thank you. I'm not seeing any other questions and there's no hands raised. Oh, here we go. So this is a follow-up comment for clarification. I thought the tax was determined on an annual amount, not just over 14 cents.
It's my understanding is it's over 14 cents, and I don't have the current Minnesota language in front of me, but my understanding is it's over 14 cents. And then I guess there will be, you know, some relationship to your tax bracket, what you have to add. Does somebody else have a additional response to this?
This is Tiffany Collins. The only thing I could add is that there is an annual $600 limit. And that's where that 14 cents comes in as well. So anyone that is on an annual basis receiving reimbursement over $600 and the over 14 cents per mile falls in the category of needing to be looking at their tax implications on that reimbursement. Hopefully that helps clarify that.
Yes. So a couple comments, kind of the same thing. Understood, not over $600. One, Shelley had said now the Senior Corps programs can receive full mileage rate with no tax implication. And then anything over 14 cents per mile after $600 is taxable. And would be decided by. Any other questions or comments? So nothing more is popping up on my end for questions.
Well, thank you. And I very much appreciate the Sherry being with us today and walking through that. If anybody wants to have a little bit more conversation about the tax implications and that, please send us an email and we'll respond to you in kind. So that way you can be resourced directly to the technical experts and this implication. As anything with tax law and taxes, it is up to the individual and how that works. Part of the issue that Sherry and the coalition and we have been working on is the complexity associated with that and the tax implication. So there's many different layers to that conversation that probably goes beyond what we can probably talk about here today. That said, and also is to the individual's tax implication as well. And that's what Tiffany was making back reference to. So very much appreciate that. It is get into those layers of complexity of that kind of thing. So please feel free to send an email to us. Be more than happy to construct an appropriate and detailed response to that. So give us a holler, we'll take it from there. Hey, I'd like to take this opportunity to introduce you to a gentleman I also have been working with for a number of years, Alan Herman, 30-year career in transportation. He's just a kid, but at the same time, he's learned a lot of things about things, and I'm still learning from him on a daily basis and very much appreciate him being here. He started himself as a student transportation, which led to the county employee. He's now recently the mobility manager and supervisor for the Scott and Carver counties. And in the past 5 years, Alan has built a mobility management team within Scott and Carver counties that is focused on linking people to transportation. Also, Alan is what we call the transportation coordinator for Scott and Carver County as the TCAP coordinator for those two counties, and actually has led the charge on a whole variety of different items on how we do volunteer programs, how do we do the accessibility transportation issues, works with very closely with Metro Mobility, Med Council. So Alan has been in the trenches and knows what it's like, and occasionally even enjoys the job too, I think. So we'll let him tell you the latest, greatest with the Hopscotch program. We've been very pleased and looking forward to hearing more about that. Alan, I'm going to turn it over to you. You're in charge.
Thanks, Tom. Great introduction. Thank you. I've been asked to kind of talk about a program that we took a lot of years to get to it. But again, just a way for we, as mobility managers, how do we get to this point? So the way we define mobility management is basically saying, understanding what your transportation resources are in a geographic area, and then also understanding or finding out the needs of those people in that same geographic area, and basically bridging that gap. Understanding that, for the people to get what they need, there has to be some sort of solutions that are available. So one way we do these is called what we call needs groups. Is we gather maybe a city, maybe a part of a township, it may be multiple cities, it may be a county, but we gather these people together, and it could be senior centers, it could be senior leaders, it could be senior groups, it could be private organizations like your veterans organizations, all types of pieces, especially human services groups, and also nonprofits, and put all these people together in a room, specifically talking about what's needed in a general area, and then discovering what is missing and so forth. One thing we found when we were doing this is, especially in the rural areas, and even though we're part of the 7-county metro area, Scott and Carver County has very rural type cities, very similar to outstate Minnesota. So what we found in those areas that if they had some options, there were very few, and some even had no options at all. So for instance, the public transit may be in that area, but it might only pick some people up in the morning to take them into another town and bring them back in that same manner that same day. So what is it that we're missing, and how can we help, especially those rural areas? Another thing that we found during that same time period was that we saw our volunteer driver numbers going down. Just as was presented earlier, we found that, again, there's confusion in the fact that Uber and Lyft came into the scene, and insurance companies were trying to understand, okay, is that a for hire? Yes, they are definitely a for hire type piece, but a volunteer was being grouped into that same for hire type category. So again, that defining that in a different way was an issue. And as Sherry had talked about, there's that 1099 piece. In other words, whether you're already volunteering and now you might have some tax implications, we were seeing loss because of that. So it just did not make sense. So one of the things we decided to come up with, what's a better way to possibly avoid these two issues and yet still have that same type of volunteer driver initiative and so forth. So our thought process was, how about if we have actually county-owned vans that volunteer drivers can drive? It's a different type of concept, a different type of piece. And at the same time, we, as again, mobility managers, we are always very cognizant of grants and anything that basically gives us a heads up on certain things. It can be technology, it can be all types of places that, again, we need help funding and so forth. So I kind of took this idea and so forth to what's called the Live Well at Home grant, and asked the coordinators of these grants, saying, can these funds be used basically to build transportation options? And they said, absolutely. That, you know, in their findings also, one of the top three things that, again, when they talk about is transportation. So part of Live Well at Home is, again, just as it sounds, it's trying to keep people in their homes for as long as you can, because they found it's much cheaper for everyone to stay living at home than in a facility and so forth. So with that encouragement and so forth, we then applied for ADA minivans. So these are small vans with a ramp in the back, and that has then capabilities of transporting one wheelchair, and then about 3 or 4 people in the van themselves as passengers and then driver. So we applied for that in April of 2020. And since this was a 50-50 match, we knew that we would have to come up with 50% of the cost of these vehicles and the program and so forth. And we went to the Scott County Board, and they were very much in favor of this. Again, looking at the fact that they also recognize that, again, the more rural parts of that county struggle with more transportation options. And they decided to use what they had was, and many, I think all communities and at this point, they use a transportation sales tax dollars as that match. And they've used it now for the last few years. And we've got actually approval that they are going to support this program through at least 2027. So again, a great piece that, again, and a great cooperative effort, understanding the county's buy-in is a huge part of this. But also during this time, guess what hits also? COVID also hits in early 2020. Next slide, please. So we applied for the grant. We were awarded the grant in July of 2020, and yet with delays and so forth, again, COVID related, we did not get our contract approved until late 2020. And the contract ran through just recently, ended in June of this year, 2022. Some of the things that we included in the grant was, we understood that this was a new program. It's going to be something different, something nobody's done before, especially in our area. So we wanted someone separately that has more of a marketing or coordinating type background to get, again, all of these partners that is going to be needed involved and engaged. Next thing we had to do is come up with a logo, basically, right? And it's actually, we have a part-time marketer. She only works about 12 to 14 hours a week. But again, that was her That was her job when she was working full time, and she has been a great job. She actually came up with the nice phrase hopscotch, and we'll show you those pictures and so forth where it came into that play. That coordinator also is going to be then in charge of recruitment. We saw basically from pre-COVID of about 15 to 18 drivers. And by the time COVID was over, we were down to 2. So that was a huge hit in our numbers and so forth. So we have to basically build that back up. It's almost from ground zero, if you think about it, to get that back and so forth. I already mentioned that, again, it was a 50-50 match of that Department of Human Services Livable at Home grant, and that Scott County was going to fund that. As Tom mentioned, we are actually mobility managers for Scott and Carver counties. And so we do a lot of other things together as a county. Our dial-a-ride programs are run together. We do non-emergency medical transportation administration for both counties. Excuse me. But this was the one thing that they decided, Scott County decided, yes, go and do this and make this happen. Carver County said, we're not sure. Let's see how you do, and let's look at our options. Next slide, please. So now that we've got the grant and so forth, who are the people that we need to engage? How do we get this started? So one of the main things, and we're very well connected already with our own human services department. So again, as we've already discovered in our needs piece and so forth, but we want to understand, okay, now let's get down to the brass tacks. We need more detail. It's not just, yes, we think we need this. No, we want actual examples of what's needed, how is it needed, when is it needed, and how much is needed. So we started with, again, 4 more rural cities in Scott County: Belle Plaine, Jordan, Elko, Newmarket, and New Prague. So right away, we had to sit down with their city councils, give them a presentation on our vision, our pieces, and so forth, because they are going to be a crucial part of that partnership. Without them on board and their cooperation, this could be, again, something we're trying to do and help their citizens, and they need to have that buy-in. We also need to engage their public works because we need to find a place to park these vans. One of the key is that we want these vans parked in those areas that the volunteers are located, so that, again, they have easy access for them to get in, jump in, drive these vans and use it for that service. Currently, we're using a lot of the libraries. Every city in Scott County has a library, and it's connected with the county. So it was a great way for us to have access for these key boxes. So in other words, a volunteer can come up, pick up the key for the vehicle, go drive, pick up do the volunteer trip, bring it back, put it in the library, and it's all good. They've got special access badge to get them in and out, even after hours and so forth. Some of the things that we're already started, we looked at, one of the things that happened during the pandemic, we found a great need for food at the food shelves and also for food deliveries. One of the things Dial-A-Ride actually did during that time was they picked up some of that slack when passengers could not be transported. They did food deliveries and so forth. But since that time, public transit has gone back to transporting people. So one of the things we first looked at was how can basically this service help out the food shelves that are still delivering food and so forth. So we started in Belle Plaine. That was a great partnership, a great leader there that said, we've never done this before, never delivered food shelf. We've always made them come to the food shelf. But she started it. She was very enthusiastic. Again, we found the volunteers to do that, and it's worked. We've had up to now 12 deliveries from that food shelf. Did the same thing on the Elko New Market side. Same thing, they did food deliveries and so forth. I think there's times that we're delivering 10 to 15 from that location and so forth. Next one we're looking at is the Jordan food shelf. So same type of thing, days, needs, and what is our process is going to be for those pieces and so forth. Another partners that we're looking at is senior buildings. What are your needs for transportation? They're sometimes very different. It can be medical, maybe it's again food, maybe it's grocery store, maybe it's simple things like getting to the library. Excuse me. And so forth. So another key partner was actually the county itself and our fleet department. These key boxes are very technical, and we can actually assign them to a certain volunteer. So again, it's not easy access for just anyone to have, but it's also their maintenance software. So we can actually monitor these vans remotely, and we know, for instance, when the battery is actually low, especially as we come into this next season of colder weather. We need to understand that, saying, okay, this looks like we need to get out there and start this vehicle. And this year we're actually testing it on one vehicle, the ability to start one remotely from our cell phone. So again, just again, playing with these things, knowing that, again, it's not in a controlled environment, it's out in a parking lot. How do we make these things happen and work? Also, as you're creating something like this, we always have to take into consideration, what are the MnDOT rules and regulations? What are the trainings necessary? If it does have a wheelchair ramp in the back, what does that mean? What are the trainings that are going to be associated with that? What's the insurance going to look like based on that and so forth? What are the trainings that are going to be needed, every year? What are certain things going to be, background checks and so forth there? That's a standard type piece, but we want to make sure that their licenses are checked every year. We want to check their insurance every year. As part of that insurance and being part of the county, we are covered under what we call MCIT. So it's the insurance trust. So you think about your personal insurance. Anytime you drive a vehicle, it's your insurance, no matter what you're driving, that covers you up to your coverage. The nice part about MCIT and being part of the county is now you've got that blanket coverage above that covers you as long as you're not negligent in those types of pieces. Again, volunteering with the county. Other volunteer organizations. So in other words, what are we missing when we're doing this? When I was creating this and so forth, I reached out to, for instance, Tiffany, as you've seen on the call here, and saying, hey, what do you guys have for, again, your processes and procedures? Again, taking a look at all the different organizations that have done through this. We've had a volunteer driver program for over 40 years. Before I was around, it was very robust and did a lot of things. So again, but everything is evolving and it always changes. We have to make sure, how is it that we're, again, making sure that we're covering everything that we need. And also there's going to be a huge part that we need to engage people with on recruitment. This is where your service groups, the Lions groups, maybe ARPA type pieces. What are we doing as far as senior groups, engaging them and so forth, saying church groups, your faith-based organizations. We need to get all those people on board. And as you'll see later, calling them the hometown heroes. Next slide, please. I mentioned earlier about that marketing and engagement type piece, or we call them the outreach coordinator. Again, their job was to engage the community and the partners and so forth, discover the needs, recruitment. But where do we begin? And how do we, what do we decide? What are the purposes? Knowing that our pool at this point is very, very small, we had to start thinking about, okay, we have to build up the volunteer numbers first. And in the old adage, right, the old baseball, if you build it, they will come. That's I think our motto, I guess, in that type of pace. So We put out a request for this coordinator, but we got no responses. You know, it wasn't a lot of money, it wasn't a lot of hours. So we changed our perspective and took that part-time marketing person we have and actually added hours for them for this hopscotch program. It worked great. She could flex her hours up to more than 20 hours a week and really kind of engage when she needed to, engage and really kind of work in a community. We really concentrated, for instance, in the city of Belle Plaine first, then went over to Elkin New Market. Now we're looking at Jordan and really kind of, putting our efforts in and really getting into concentrated efforts. So there's ways, for instance, to, I'm going to get this wrong, Stacy, but you can focus a Facebook or a next door advertisement for volunteers. I don't know what it's called, but it works really well. So in other words, you can really work on an area as far as recruitment and so forth. And I'll talk a little bit later too about our COVID impacts of when you can't get to your vans, when do you start to recruit for your volunteers? So chicken and the egg, which do you start with? We need both, but if you can't get one, where do you go from here? Next slide, please. Talked a little about the van. We thought that with where we come with the logo and so forth. And we purchased the vans back in August through November of 2021. We basically had to pivot. So when we did the grant, we thought, okay, we can get new vans. That's not an issue, right? Should be just go pick one out of the lot. Not so much. With COVID and so forth, we had to kind of decide we're not going to find new vans, but we did find a local vendor with national type power. And we found 3, what we found very excellent type vans. Even though one is a 2013, 2018, and 2020, but in very good shape, very, very clean, not a scratch on them, and yet very purposeful. So in other words, they really fit well. And we were surprised with these types of vans right away when we got into them. The sight lines were so nice in these vehicles. A lot of times when you get into a SUV and so forth, there's a lot of sight loss, but with these vans, I don't know how it is, works out well, but we can see very clearly, which again, that's exactly what we're looking for. We want the ability for the volunteer to see clearly is a great way to look at that program. Again, these are county owned. They are basically then under that county umbrella of MCIT. They are handicap accessible. It is one wheelchair and it's not a big area. I know as transportation providers and so forth, there are lots of larger type of wheelchairs and so forth that are out there. This would not be something that would be able to be done in these. When we come across something like that is a larger wheelchair and so forth, we then, being mobility managers, we then kind of hook them up with the transit link side or the dial-a-ride buses that have the bigger ramps and the capability of doing those types of trips. They are county maintained, so our local shop takes care of all those vans. As I talked about, it can monitor those and we keep those pieces moving and so forth. It's localized transportation. So no, we are not going to take these vans and head to Duluth with them. We decided very early we're not going to head to Rochester. And we want this to really be a way for people to get around the local type areas and get served in those ways. And that was a very definite piece that we wanted to make sure. And that's what we found was the biggest gaps, was the local type transportation, and that's what we focused on and so forth. So we actually have a county software also that we use to access that the vans and so forth, and it gives that van assignment type piece. So we could take a volunteer and let's say they are in Belle Plaine, and we have a van in Belle Plaine, and assign them accordingly. But let's say that van in Belle Plaine is broken down. We do have the ability to, again, reassign that vehicle to someone that's in Shakopee and so forth. And so I talked about the pivoting of not new vans, but we did have to go to used vans. Next slide, please. Now, the volunteers. It makes it a little different, but at the same time, we gave them the options of, yes, it is a volunteer driver program, so you still, if you would like to, you still can drive your own vehicle. But what we have found so far is that everybody likes to drive the other van. Again, personal reasons or whatever the case may be. It's easy to do. It's in your own area. You don't have to worry about all the extra paperwork. You don't have to worry about any of those types of schedulings and so forth. You know, it's drive your car, or maybe sometimes you can walk to this van, pick up the van, do the trip, bring it back, and you're done. It is just that simple and so forth. All of the volunteers are still vetted and trained by SmartLink. So again, we require certain things for them before they can start driving. We do all the intake and we schedule the drivers accordingly, according to what, and understand when they're available and so forth. Already talked about that the van is parked locally. Right now we have 3 vans, but we have 4 places that they can be. And we're looking again, possibly going into New Prague as another area that we're looking at. And the county commissioners have voiced that they would like to see at some point in time, Hopscotch cover the whole county, not just the rural areas. So again, that is something that the commissioners have really found it is a very helpful piece to this. And they are so supportive, again, that they want to actually expand on this piece. One of the new things that we're also seeing is a different type of driver. If there are people that want to drive, we have weekend and evening service available. Again, this was something different. We had only offered typically your 8 to 5 Monday through Friday type of service and so forth. And this new kind of volunteer is also younger and so forth. We've got 20-year-olds that are working their job all the way during the day, coming home, going to the food shelf and delivering those meals. Again, something different that we've not seen before, and a great asset that we were probably missing and so forth. We give them a choice also whether they want to be able to handle wheelchairs or not. If they want to, we actually have extra training for them for wheelchair handling and so forth. And at this point in time, we're about 10 to 12 new volunteers, again, driving in their local area and so forth. Many of them are still newly retired and so forth. And something else that we changed from our previous volunteer drivers is that these do not handle any fares. Previously, we always had them collect a fare. Now we use what we call donations. And when we are booking the trip and so forth, we'll tell the passenger, I'm sorry, the envelope, which will have our address on it, and it will be already pre-stamped. That envelope will basically have that fare. You put that fare into the envelope, lick it shut, put it in the mail. Here we go. It comes to our place for that type of donation, I guess is the best way to put it and so forth. Next slide. So where are we currently and where do we look to be in the future? We started our first trip in December of 2021. We didn't start client transports because of COVID until actually May of this year. The van checkout, again, allows van placement in the rural cities, but actually we, again, could go to, since every city has a library in Scott County, we could have 7 or 8 of these placed out in all these types of areas. We are still doing a very big volunteer recruitment piece. For instance, this last month now, we did a radio ad, which then came with a radio interview as a package of that. We also put out at the same time, this was all a coordinated effort in a very short amount of time, a county newspaper, quarterly county newspaper comes out. So we had a big feature ad in that about Hopscott. And then we also did follow that up with the current newspaper ads. So the very good process, because what we're looking at is it's sight, right? The more people see something, the more they recognize it, the more they are going to ask questions about it. And then that also leads then possibly to them getting involved and wondering what that is. Well, yeah, and that's half the battle. You know, if you can get them to ask what it is or what they need to do, that's a great place to start. Current uses, I talked about the food shelves. We are also transporting for the mental health center in Scott County 2 days a week. We're looking at 2 of the senior buildings, a family resource center. That's a piece that Scott County is starting up right at this point and so forth. It's basically almost an after hours type service center, again, in a more local town or more rural area, instead of having to go to the county seat for services and so forth. We also, many of the providers and so forth have understood that the non-emergency medical transportation network with those high prices, that system also struggled through this time with those high gas prices and so forth. So again, we use some of our volunteers and those vans to transport those that were being missed and so forth in that network. And then it could be random medical requests that, again, could not be done by, again, our local bus service or in any other way that we could get that person done. As I mentioned earlier, it is a very purposeful rollout. We don't want to put it out to everything because we have a very limited inventory. So when we have a limited inventory, we want to make sure that whatever is out there, we can cover. So at this point, with the number of volunteers we have and the current uses, that's about what we see. But at the same time, now with this latest marketing piece, I know we have 3 new volunteers in process that are located again in different parts of the county. So, and for instance, the mental health center, right now we're doing only 1 route for them. They want us to do a second route. So there's more demand coming in, and again, and also more volunteers. So it's starting to match up those pieces with that inventory. We also have a software on our non-emergency medical transportation side. We are using that same software to track the needs. So we have easy way to track what's being done, you know, how long is it taking us, the number of miles, all that type of information in reports and so forth. And this same software has the potential even that people could call or book the request without even calling in. So it does have the capabilities to have that done. Next slide, please. Here's a picture of our youngest volunteer. And as you can see, the Hopscott label, very great graphics and showing basically a vehicle flying with, again, that great logo of hopscotch, kind of the play on the word hopscotch. But you also notice on the driver's side door, we put this very methodically. We thought, let's put on a little piece in there for that driver, driven by that hometown hero. We use that phrase hometown hero a lot in our basically our pieces of advertising, marketing, and so forth. We want to, again, bring home that piece. And again, hopefully as that vehicle's driving through town and these people see that, they're going to go, hometown hero, hopscotch, what's that? Okay, well, head to this website and find out what's going on. So in that type of piece. Next slide. I think, yep, I think that's it.
Does anybody have any questions for Alan?
Well, thank you, Ellen. I think, do we have any questions or chat box? I'm not seeing that.
No, we don't. He did a very thorough presentation. There's no questions.
Well, Alan has been in this business for quite some time and knows a lot of the aspects of this. And as much as Alan went through in glorious detail, and we thank you very much for doing that, you can all tell that it takes time to build these relationships. And so, Alan, when you're talking about this, and at the very beginning, you said, we've been doing this for a while, but when you're talking about this program, what are you talking about? A lead in of about almost 2.5 years, correct?
Correct. So yeah, again, our process began probably about 2019 in trying to, how do we solve this issue and so forth. And again, it was end of 21 before we actually got anything done. So again, that's a 2-year process to, again, start to finish. And again, and it really aren't, we're never finished, right? One thing everybody knows on these calls is volunteer drivers. If you aren't recruiting or retaining them, you are losing them. So that's a constant type of piece, just understanding again what their needs are, how do you better serve, again, because the volunteer is actually your customer, right? You need to treat them and understand what their needs are to help them do that job better.
Right. And I one of the things that, you know, many of us are sitting in this meeting, work with volunteers, are volunteers, or and have a fairly decent appreciation for that. But it's a relationship building. And that's what Alan has demonstrated, and many of our RTCCs have been working through, and as well as the TCAPs in the metro area have been working through with building these relationships and building these partnerships, because it's the diversity of the partnerships sometimes are really hard to manage, because you got these 8 different groups who want to do 8 different things, but they're all kind of similar, but they're all kind of not. And you're having to have, you know, the different personalities that say, well, we want to do it this way. And managing that in a collaborative way takes time. It takes time, and it takes a lot of patience. And it does require a certain amount of talent. Thank you very much, Alan, for providing the talent to that end. But at the same time, it can be emulated. It can be done. Many of our RTCCs have been inspired by what Alan's doing here. And there's a lot of what we refer to as volunteer driver vehicle sharing programs. This is essentially the generic term for what Alan has done. And different versions of that is being considered, looked at, and being developed as we speak. So as you go back to your backyards, your own county, to your own geographical area where there's an RTCC, please get engaged with them and start looking at these different opportunities. Is it going to fix your problem next Tuesday? The answer is no. one of the biggest things that Alan made a comment that everybody thought was just a given. Well, it's never going to be a problem for us to get new equipment. Well, yeah, it is. And that's a continuing, issue that's going to play itself out over the next supply chain problem that we're going to probably have for the next year to 2 years. And as we go through this, people get kind of like frustrated. And that's the key thing, is you got to keep your eye on the prize. And that's one thing I really appreciate with all the people we work with, Alan especially, who's managed to kind of keep this vision of how we can actually make this happen. But it isn't just Alan who did this. Alan made this pull together, and other people bought into it because it is real, it is viable, it has its opportunities. Is there some downsides to it? Everything has a downside. And it gets back to Alan's point he made earlier. You always have to kind of revisit it. You always have to come back at it and say, are we doing what we're supposed to be doing? Do we have the right people engaged? So again, I very much appreciate Alan's time sharing with us today. Any questions, thoughts?
Yeah, we do have one other, you did answer it, Tom, but I was wondering if maybe Alan would have any other insight into it. The question or the comment is, now that the so-called template is done in Scott County, does he think that it would take that long to set something like that up in another county?
I guess the main question there is, how quickly can you get new vehicles?
Right.
That was our struggle, right? So we thought, okay, this will be easy, Joe, go get some new vans and we'll start recruiting right away. Well, if we couldn't get the new van, how could we put the recruitment out for the volunteers? So it was a wait and see type of piece. So you basically saw that we sat around trying to figure out what are we going to do, and had to, again, pivot in different ways and so forth. So, but in the meantime, it gave us time to really kind of hone in on, okay, what are the processes that are going to be needed? What are some of the trainings? Again, are we making sure that, again, we are doing things totally above board, and what's the right way to do this? What's the right way to even charge a fare? No, we're not going to charge a fare. We're going to have it as a donation. So those types of pieces, I think, are going to be easy to kind of copy at this point in time, because we've kind of done a lot of the background. But it really is, as Tom mentioned, it's the supply chain. Can you start this and make this happen? I did a presentation for a couple of counties, northern Minnesota, and I said, maybe not start with an ADA van, but maybe it's an older county vehicle that maybe is going to be retired. Maybe start it that way, and be patient. Got a quick story about I've been always trying to work with our local veterans services, and it's probably taken me much longer than I thought, but I finally, now the dialogue is here and we're moving in this direction. He sees the benefits of what MCOTA is. So we're not going to take away anything that he's doing, but how can we supplement? How can we do more for the veterans possibly, in this case, and so forth. So again, I was gonna keep your eyes open. You never know when the next door will be opened for you, I guess is the best way to put it. So, but yes, I do believe it shouldn't take much. Again, but there's different ways that this can be done, right? There's a nonprofit. So I talked about Minnesota County's Insurance Trust. There's a nonprofit insurance trust also available at the state. It's in legislation and so forth. So a nonprofit could get that same type of insurance buffer or insurance maximum, I guess, is a way to look at it. So there is that type of stuff out there. Now you do have to, again, join that consortium of that insurance and so forth. But again, there are possibilities of even nonprofits. It doesn't have to be a county or city.
I have another question, and I think you just answered it, the first part of it. How much are fares? And then the second part is, will you sustain program with the Live Well at Home funding?
First one is we actually base our fares on distance. We charge $2.50 for up to 5 miles, $5 for up to 10 miles, $7.50 for 15 miles, and $10 for over 20 miles. Now, as we talked about, we like to stay local, so 20 miles in our county, that would be from one tip to the other tip, and so forth. So a lot of our trips are more in that $5 range, and that's what we've seen so far is the main fare. And the second part was sustainability. Right now, I have not had to go back. I don't plan on going back, but I'll probably use Live Well at Home for, if I do again, would be for van replacement. I know for a fact that our local human services has actually put in a different grant for another van. So they have again appreciated and stepped up and asked for another van. We don't know if we got it or not yet, but that's, I think, how we will use it. If you think about it, our low costs and so forth, once you have that van, there's not a lot of costs. We're not paying the volunteers any mileage if they're driving the county van. So there's very low cost here. So what do we have? We have gas and maintenance. That's our big costs. And right now we are doing actually okay and actually in pretty good shape to sustain that system that way. And again, as I said, the county board has said they will use that transportation tax dollars in the future to, again, continue that 50% match. But another piece that I'm looking at is seeing if MnDOT in their 5310 program would look at that type of a smaller type vehicle for these purposes also. Not to put you on the hook, Tom.
We have another question from Terry. Would you still have to outsource the marketing to get new drivers in a new area, or have you learned how to do that on your own?
Both. I would recommend if you the way we did it was because we had the grant, we had the availability, we put the money in there and it was accepted. Would I do it again? If I was starting out, it's always nicer to have more people looking at the same thing. And again, we were lucky to find someone that had that marketing background already. And because she thought of things that we never could, especially when we think about transportation systems and so forth. A lot of times when you're operating something, you're too busy operating it to market it. And in this case, that's what she does. She takes care of that piece and really works on that piece. So.
Great, thank you, Alan. I don't have anything else on here right now. I do see in the chat, there is, Sherry put something in the chat box about the 14 cents a mile reimbursement, and is a link on there. If anybody wants to click on that, you can learn more about that. Yeah, so take a look in the chat box when you get a chance. Not you, Alan, but folks that are interested in learning more about that. I got nothing else here. Anybody else have questions? It was great. Thank you.
Well, thank you. Thank you, Alan. I appreciate it. Again, I've heard this presentation maybe about the third time, and every time I do, I learn something new. So I don't know, either I'm not paying attention close enough the first 2 times or whatever, but thank you. I appreciate that. And it does give us an opportunity to kind of think again out of our collective box that we've historically, been looking at this at a different way. And we're exploring right now with all the RTCCs and the TCAPs, there are exploring various different variations even of what Alan has pulled together and how that's going to work. Every local partnership is going to create its own flavor of how this is going to work. Sustainability is going to be based on what is the local program funding courses or funding sources, excuse me, sources. Maybe it should be courses on figuring out what the sources are, but whatever funding sources there might be. But at the same time, there are state and federal programs as well, not just from FTA or MnDOT, but other agencies as well, as the Live Well at Home is a perfect example of what DHS has. But again, that program is a 2-year program. So it's, you can re-up again and you can do that, but it's not a foregone conclusion that you're going to get the funding again for the next, 2-year cycle. So sustainability of these programs is one of the key things that we're trying to look for at MCOTA and how we're trying to address that. Something that this work team, the volunteer driver work team with MCOTA, is also paying attention to, as well as some of the other work teams and other initiatives that are in play. That said, if anybody has any questions that we end this workshop, we go back to our respective work items sitting in front of us right now at our desk and say, hey, I forgot to ask about whatever. Please feel free to send the send us an email. We'll give you a follow-up on it, just like Sherry did relative to the revenue guidance associated with how that tax implication would play itself out. And that's one of the things we have to pay attention to, is we do not have an overall arching, what is your individual tax implication. It is going to be an individual that has to do that. And that's part of the reason why we did the guidance. We gave the information. We are working with the Department of Revenue to help them be more commutative or be able to share that information in an accurate and an appropriate way. But again, the big telltale sign of the discussion is what's going to happen at the federal level from a fiscal point of view and related to the impact of the individual drivers. This federal legislation is really critical because most of our taxes are paid at the federal level, and that's where most of the impact is occurring. And as Alan got into the discussion, we're trying to make it easier for volunteers to be exactly that, volunteers. They did not come here with the idea that now I have to fill out more forms. I have to figure out how to do my taxes. I have to do this. I have to do that. This program that Alan and Scott County has, hopefully Carver will step into the fray, but we'll see. That said, are creating a situation where it's actually easier for the volunteer to do exactly that, volunteer their time. And that said, that's why we're here, and this is why we continue this conversation. Again, I think you saw the notice of the 16th of February. Please put that on your calendar. It will probably be held at 1 to 3, as it seems to be our typical time frame. You noticed today that we may be wrapping up before 3, unless somebody has some real big question they want us to follow up on. We're more than happy to listen to any follow-up questions, comments, thoughts. Well, that said and not heard, I am going to wish you all a wonderful afternoon. It's gorgeous here in the Twin Cities. Hopefully it's nice where you are at, and hopefully you get out and enjoy some parts of the day. We will be gathering again on February 16th for the next one. You will be getting some notifications of that. Right now, I think we had up to about 78 participants in this meeting. So thank you very much for taking your time and sharing this space with us at this time. So have a great day and great evening, and we'll take care.
Thank you, Tom, and everyone who spoke, Sherry and Alan. Is there anything else that you all as panelists group need to chat about before we end this?
I think we can pick up our conversation offline, and thank you again, Alan and Sherry, if Alan's still with us. Thank you for taking the time and bringing us up to speed. Nicely done, very much appreciated.
Really
Awesome.
well done. Really well done. Thank you.
Thank you all so much. Have a great rest of your day. We'll talk offline. Thanks.
You bet. Take care. Bye-bye.
Bye.